Okay. When I posted this on the community tab, a lot of people were eager to hear the update. For those that don't know, I had been diagnosed with glaucoma, and despite the fact that it's common in older people, I'm not old. I'm a middle-aged man in my 30s. Unfortunately, I had it because of my family history. My mom is currently managing glaucoma.
Let's do a very brief crash course on the risk factors for glaucoma. Know that I'm not doing this to scare you, but to give you some enlightenment about this, as I believe this is going to help you. Earlier in the video, I had mentioned two risk factors already, and they were age. It's common among older people, that's from 55 years and above. The second is family history. If any of your relative, those you're directly related to by blood, is having the disease, you're likely to have it, but that doesn't mean you must have it. Your race is also an important factor, as blacks, Hispanics, and Asians are more likely to come down with the disease. Another is if you have any form of refractive error, if you're long-sighted or short-sighted, especially if it's severe. If you have any medical conditions such as diabetes, hypertension, migraines, or sickle cell anemia, the likelihood of you coming down with glaucoma is very high. Then the next is any form of eye trauma, especially if you've not managed it properly. The misuse of corticosteroids in the eyes is a very significant risk factor for glaucoma. Please adhere to how the drugs are being prescribed to you. There are other risk factors, but I think this is good enough. Abby, yo, let's continue.
So last month, I was started on an eye drop and given 1 month to come over for the follow-up. Today, as at the time I was shooting this video, I went to the hospital to see the ophthalmologist so that they will review my eyes again and will know where to go from there. And the good news is that my intraocular pressure, that's the pressure of my eyes, now normal. As at the last time, they were slightly raised, but then now they're normal. And I would continue the medications that I was on, the eye drop, and I would see her after 2 months. For someone like me that's not in my 60s, because of the family history, I've spoken about that in my earlier videos, I had to be careful. And if I had not seen the doctor on timeline, it's very possible that I would just notice that I'm losing my vision, and eventually one day it might be really bad. So this is something that I would really advise you people, that please don't ignore your family history, family health history or medical history. Don't ignore that. If you come from a family that are hypertensive or diabetic or having any disease like that, please don't ignore it. Or don't say blood of Jesus and just leave it. It's better you know and tackle it on time than to assume so. Or you might present or come to the hospital at a time that little or nothing could be done about it. And this is something that I did. So when I saw the doctor, my mind was already open. In as much as I was hoping that it was not that, it was just the refractive error. But somehow at the back of my mind, I knew it was a possibility. And the good thing is that as at the time I was coming, I was just having some forms of eye discomfort. I can still see. So if it's been diagnosed, if I have it, hopefully it should be treated in such a way that I don't lose my vision or my vision does not deteriorate. So this happened and I was started on the medications. And the thing is that I was given a month because my intraocular pressure was not too bad, despite the fact that it's being raised. It wasn't too bad. If it was bad, maybe I would need to see the ophthalmologist within a closer date than 1 month. It happens so that the intraocular pressure might be monitored properly. But because mine wasn't too bad, that's why I was given a month. If, as at the time I came here and the intraocular pressure was not too impressive, maybe I might increase the frequency in which I apply the drugs, or they might give me a more powerful drug to try it out. But eventually, if they find out that the drugs are not working, I would have to go for a surgery. There's a surgery for that to help reduce the intraocular pressure. If it's being cut on time and intraocular pressure is being maintained, you have no problem. You just live normal life. It's just that you would have to be doing frequently for review. to see whether the intraocular pressure is normal or not. It's almost the same principle with that of hypertension. So far as the pressure is normal, there's no problem at all. Just continue to maintain the normal pressure and you're okay. And currently, as it's normal, after 2 months, I would go to be reviewed. And from there, we'll know what to do, whether I'll continue to have a 2 monthly visit or they might give me a longer time. But I know something that I will probably continue this eye medication till, because I'm getting older and old age is a risk factor for that. So it's not something that I would apply now and be like, okay, I'll stop at a point in time. Whereas the risk will be higher then. If at this point in time, I'm already coming down with it, then the risk is even higher as I get older. So it's something that I've already made up my mind. I'll continue medications for as long as I live until maybe the ophthalmologist see and tells me that there's no need again. Maybe it's a possibility, who knows, but I'm already prepared for that. I want to see I want to continue to see. I know that eye doctors or ophthalmologists are people that generally people don't visit except there's a problem. But once in a while, go and visit the eye doctor and be assessed, especially as you're getting older. If you have any form of eye discomfort, please don't just carry yourself and go and get any form of eye drops. Eye drops are not eye drops. There are some eye drops that are even dangerous to you. So please go for regular checkup. I'm telling you this because even while I was in Nigeria and was in the ophthalmology department, there are many young people that had been diagnosed with glaucoma. And at the point in time, it was already terrible. There's little that could be done about that. That's how unfair life can be. And that's why you have to be proactive when it comes to that. Anticipate it. Fear is not going to really help you. Just be brave enough to face it and hopefully it should get better. So I'm okay. I'm happy that my pressure is normal, intraocular pressure is normal, and my next visit is in 2 months' time. Definitely, I'll keep you updated. So please go to the hospital, go and see an eye doctor. Thank you for the love, thank you for the support, and I'm okay. I'm very okay, and I'm very happy to announce this to you guys. If you enjoyed this video, please give it a thumbs up and you can share it with someone or some people that would benefit from it. And if you're yet to subscribe, subscribe and turn on the bell notification. I'm Dr. Tabat and this is what I love doing, sharing health information to help you improve in terms of your health. So thank you and I'll see you in my next video.